Sarah, thanks so much for being with us. Talking about your daughter, Maddie, as she was known, she was such a special young person and a wonderful representative of Children's Miracle Network as a hero. What was it, her situation, that brought you to be a part of the CMN family?
Maddie was a hero kid, so we got to, we were asked to do that. That was amazing. Get to do the fun stuff, the gala, the parades, the neat events. But the reason, I guess, that she was picked or how we came to know about it was because she had a lot of medical needs. And so her time in the hospital was often made a smidge better by getting things from Children's Miracle Network, getting meal vouchers and things like that. So we got to know CMN through her donations, and then we were lucky enough to be able to be a hero family too.
And what was her medical situation?
Yeah, so she was a normal baby, normal pregnancy, started having neurologic issues, started having seizures, hearing loss, vision stuff. She had a feeding tube and then respiratory needs too. So those things were all kind of her medical combination, but she didn't have an overall diagnosis. So you couldn't be like, oh, she has blah, blah, blah disease. It was just undiagnosed, but lots of different complications.
Yeah. Now, when did the conversation of hospice and palliative care come into effect?
Sure. So palliative care came up when she was 2. And I think a lot of parents have this experience, but we were like, oh yeah, no, you have the wrong people. Like we don't need palliative care. And so when she was 2, we kind of weren't really open to that conversation yet because she didn't have a diagnosis. So we were feeling like, oh, we don't know. Who knows? She's only 2. And she lived till she was 9. So really that was 7 years before. And then probably when she was, I'd say 5 or 6, when her respiratory needs started increasing and she started having this immune system issue where she'd get injections at home and stuff, it became more obvious to us that probably palliative care would be something in her future. And then we were in a better place to hear it too, because we had lived this life.
Yeah, and you were part of a pilot program with palliative care.
Yep, through CMN. So that was one of our projects that we got to be part of. So we would go to a conference room, sit with all of her doctors. I would usually bring her pediatrician from the clinic because we knew her the best, and we would just talk kind of about like quality of life and what was important to Greg and I. It was nice because we would be able to have those conversations in a controlled setting. Like it wasn't like you'd up for all night at the hospital bed and someone's trying to tell you something. Like that's really difficult. But this was like, schedule it when you can come in, we'll have this meeting, we'll go over these different topics. And they would always be asking like, well, what's important to you? What do you guys like doing? What do you like doing with Maddie? Rather than like, well, here's what she has to have, here's her medical treatments. After we learned more about it, we were like, oh, this is a good thing. But it didn't, it felt scary at first.
I was just going to say, and you mentioned it, it is something that can be scary. I can only imagine for parents who are first hearing that word and hearing and thinking about the implications of it. But Children's Miracle Network was, again, there to help guide you.
Yeah, absolutely. Yep.
Can you tell us a little bit about why you think it's so important then to support this effort now with CMN for other families?
I think making the word palliative care be more visible for kids. I think we hear about it a lot for adults, and sometimes we only think about it like cancer treatment in adults, and it's like it really means a lot more than that. But it is a really weighted term, and so I think if we just talk about it more and say like it's about quality of life, it's about having kids be included in their family in a meaningful way. It's also about healthcare providers hearing parents a little bit more than maybe they have been in the past. And just kind of understanding there's more than one right way to do things with kids. So I think it's just important to make it doesn't have to be so scary and so sad. And of course there are those aspects of it, but it's generally positive. And it's like, hey, what can we do for your kid? What's helpful to you? What do you value in your family? So I think that's why it's important for Children's Miracle Network to have this focus this year, is just for people to know that it exists, and it can be a really good thing for families.
Helping carry that burden a little more, like CMN does so well.
Yeah.
So Sarah, thank you so much for sharing your story.
Yeah, you're welcome. Thanks.